chat box. Um, you do not need to have, you do not to, excuse me, pre-register for that. You can just join. All are welcome. I also want to announce that DC Department of Health has a plethora of smoking cessation educational materials that is available to be shared with patients, employees, et cetera. And those include brochures, pamphlets, and it ranges in topics from teen smoking to just information on in terms of the smoking sensation benefits and education. So if you are interested in receiving any of those educational materials, please feel free to reach out to me via email and I will connect you with the DC DOH representative that can provide those materials to you. Also, at this time, I want to open it up to our presenter, excuse me. Our first presentation is going to be from Ms. Rachel Reese with Cancer Support Community, and she's going to share some resources that her organization provides. So Rachel, I'm just gonna give you rights to share your screen.
Perfect, thank you.
Yeah.
Well, while you do that, I will introduce myself too. I'm Rachel Ress. It's so nice to be here and I appreciate you all giving me some minutes of your morning today. I am a clinical social worker by training and the community navigator for Cancer Support Community in Washington, DC. So let me see here if I can go ahead and share my screen. You're all able to see the slides?
Yes.
Okay, great. Let me just start here. Okay. So I just thought I'd just start also by sharing a little bit about my background and sort of course, introducing you all to Cancer Support Community. I've said this to some of you on the call that I met with before, but prior to being at Cancer Support Community, I was a social worker at Georgetown and their cancer center, working primarily with breast, brain, and lung cancer patients in the inpatient and outpatient setting. And throughout my time there, I really didn't know much of anything about Cancer Support Community. So I, think that I may have referred, folks once or twice there, but really didn't know a whole lot about us and want to take this opportunity to share about the resources that we have with you all so that hopefully, we can bring these resources to the patients and caregivers that you all work with. So with that, let me just share our mission here at Cancer Support Community, which is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. Broadly speaking, what we do falls into three different categories or pillars, if you will. The first being direct services, which is primarily what I'll talk about today. But I wanted to also just highlight that we have both a policy and advocacy arm, as well as a research and training institute as a part of our services and what we do. Of course, with direct services, that's delivering support to folks impacted by cancer, both in DC and throughout the country. Our policy team is based here in Washington, DC, and our research and training institute is primarily based in Philadelphia. And these three pillars sort of work together to create a cancer support community. I like to share this slide because it really just shows our reach, both nationally across the US, but also a few international locations as well. So we have cancer support communities or Gilda's clubs. It's a different name, but they all fall under Cancer Support Community throughout the country, as you can see, as far away as San Francisco Bay, North Texas, Madison, Wisconsin, and then here in Washington, DC. Last year in September, we, I like to say, opened our virtual doors to programming and support to those living in Washington, D.C. specifically, but also anyone living in the DMV area as well. Our core values at Cancer Support Community, I just wanted to highlight quickly, and of course, dive into our program model and talk about the services that we do have, but quickly just to share some of our values with you all. The first is to care for the whole person and to think about the patient and their family as a part of the care that we need to provide, and giving a holistic approach to care that goes beyond the medical support that they receive, meaning mental health support, social support, etc. All of our services are free, so we never charge anything for our support, whether it be a support group, a meditation or healthy lifestyle class, or short-term counseling. And I'll get into more of what those services look like in a few minutes. We also really believe in the collective wisdom that all of the patients and caregivers that participate in our programs and offerings bring, and how that collective wisdom really enriches the community as a whole. We strongly believe that everyone is the expert on their own experience, and we encourage throughout our program, folks to share their experiences with others in order to strengthen the community and build that community as well. And with that, empowerment through community is certainly a big piece of our program and of our values. And of course, finally, last but not least, creating a respectful and inclusive environment. As far as the program model goes, this I really just wanted to sort of break it down into a quick look at sort of overall the process. And of course, that starts with onboarding. And I'll talk a little bit later about the best way to refer, but really, when someone comes through, again, our virtual doors at Cancer Support Community, we are going to introduce them to all of the services that I'll tell you about in a minute here, and really orient them to what Cancer Support Community can offer, and telling them about our services. We also do complete a distress screen, really to get a better sense of what type of support they may most benefit from, and also to take a look at and see, levels of anxiety, depression, if there's financial stress, access to care, any of the typical distress screener questions that you can think of are included in that process. Again, so we can create a more tailored approach to providing them with the best support. And based on that onboarding process, we link them to services, whether that be Cancer Support Community services, our support groups, healthy lifestyle programs like meditation, individual counseling, etc., or other resources in the community, maybe making a referral to transportation services or food delivery. So making sure they're connected to what they need. And our goal with this process is to create a positive psychosocial impact and thus better health outcomes. I know there's a lot on this slide, and I was told the slides would be sent out after. So this is really more for your reference than anything else. It just breaks down some of the major components of our program, and it's, broadly speaking, that falls into 5 core components: our support services, support groups, our educational programs, our healthy lifestyle programs like meditation, yoga, etc., our social connections, and then resource and referral, which is really where that patient navigation and community navigation rather falls into. So I'll talk a little bit more about these different programs in the following slides. But again, this is more for your reference than anything, so I apologize. I know this is a busy slide. The first resource that I really just wanted to highlight is our education resource, which is our Frankly Speaking About Cancer. This is award-winning material covering, as you can see, a broad variety of different topics related to cancer. So anything from disease-specific materials to topics that would really be applicable to anyone with a cancer diagnosis. So how do I talk to my kids about cancer? How do I navigate clinical trials? How do I, be a caregiver, and what does that role look like? These are all available on our website. You can read through them and click through them. If someone needs a physical copy, we have that as well. And some of our educational program offerings like webinars and things along those lines are based on these products as well. The next resource that I wanted to highlight is our Ask Ruby. She is our virtual cancer support community navigator. So she is also on our website and offers a lot of different information, a lot of different videos on different topics for cancer patients and their loved ones. So anything from, as you can see on the bottom, to how to file for unemployment or apply for disability, to, how does COVID-19 impact a cancer patient or loved ones, et cetera. So she is a good resource for those looking for sort of in the moment, on the go, if you will, information. The next and sort of not most important, but one of the more important things that I wanted to talk about too is our virtual programming that we have here specifically in DC. So as I mentioned, we opened our virtual doors in September of last year. We don't have a brick and mortar yet. Our goal is to have a brick and mortar hopefully next calendar year in either Ward 7 or Ward 8 to have a physical location so that folks that live in that part of the city or live in the city in general are able to come physically and be together and get support. But for now, it is virtual over Zoom and over the phone. And all of our sessions and programs are offered by licensed health professionals, as well as some volunteers, and again, focusing on a variety of different topics. The next program that I wanted to highlight is something that I'm trained in myself, and I think is a really great program and offering, especially for those who are maybe newly diagnosed and making a treatment decision or facing recurrence and needing to make a decision at that point in time. The treatment decision-making program it's a guided discussion with myself or someone else. And the goal is to assist the patient in getting all of their questions sort of organized and written down in a way that they can bring their questions and their goals to their doctor at their next appointment. The feedback that I've gotten from this program is really that it helps a patient feel a little bit more grounded when they're walking into their appointment with their doctor. They have a physical copy of their questions, of their goals, of sort of where they're at as far as what they know about where their diagnosis or treatment or what have you might be. And they feel more organized and more grounded going into that appointment. So that's another program that we offer that is available, again, of course, free of charge to anyone. The next is our helpline. Our helpline is, of course, it's a national resource, but I wanted to highlight it as well. It is available Monday through Friday, 9 a.m. to 8 p.m. and Saturday, 9 a.m. to 5 p.m. The helpline and those who support the helpline can provide personalized support as well as counseling to cancer patients and their loved ones. There's a phone number here on the slide. There's also a chat option if you go on our website. And again, this is a resource for folks if they have sort of in the moment questions that they want to be supported in or connected to resources for. And next is our My Lifeline. It's our personalized digital community. It is really a way that folks can keep themselves connected to their family and their friends in one place. So I know, when you're newly diagnosed, going through treatment, a lot of the times you're sort of bombarded with phone calls, with emails, texts, how are you doing? What can I do? And it really offers one place for the patient or the caregiver or the family member to update and also enlist the help of individuals in their support network, whether it be organizing rides to appointments or meal delivery, things along those lines. It also is an opportunity for folks who are connected to connect with other patients or caregivers in the My Lifeline network. So it's a great way, digitally, to create community and get connected that way as well. I talked a little bit about this resource, but we do have a cancer support source distress screener, which again is a brief intake that allows us to take a look at what an individual may need and what their biggest stressors are, so that we can connect them to the resources that align with that. And it really helps us to get to know them, and also to take a more specific and targeted approach in providing support to that patient or caregiver. And then finally, I just wanted to again highlight our referral process. I'm a big believer in whatever is easiest for you all as far as getting a referral or referring someone to cancer support community. That's fine by me. So if that means the patient or the caregiver wants to take the initiative and give me a call, send me an email, go on our website, that's great. If it's easier for the navigator or the social worker or whomever to send me an email or give me a call and give some background about the patient or the caregiver that's being referred, that's fine too. But there is a form on our website that allows someone to set up a profile and then sign up for events on our calendar. And then, as I mentioned before, the onboarding process is the same. Of course, sharing about cancer support community and sharing about our resources, and then doing a distress screen to really, get an understanding of what's going on and how we can best be of support, and then linking them to services that reflect that. So with that, I'm happy to answer any questions. I have my contact information here, and of course, I am available by phone and by email, and happy to answer questions now or later on as they come up. But I really appreciate everyone's time, and I will stop sharing just now and see if there's any questions.
Thank you so much, Rachel, for sharing the very, very important resources that your organization provides. With that being said, are there any questions for Rachel? We'll have additional time at the end of all the presentations, but we have a few more minutes before we jump into our next presentation. Does anyone have any questions? Okay. Well, I actually have a question, Rachel.
Please.
I know with with the economy just being the way it is right now, there's a lot of patients, families that are going through a lot and just in need of like food resources, financial resources. Can you speak a little bit more about how your organization has been able to navigate those needs?
Sure, definitely. And thank you for that question. One of the nice things about being a part of a national organization like Cancer Support Community is that we have sort of access to different resources, both locally and nationally. Our helpline does have a program right now that offers a grant for transportation specifically. There's a really easy application that I can fill out on behalf of a patient or a caregiver to help connect them to that. And that's just one example of a resource that's speaking to that financial piece that so many people are needing support in right now. And as far as resources that perhaps Cancer Support Community doesn't have within CSC, within Cancer Support Community, part of my job as a navigator, and as a lot of is to connect the patient or the caregiver to a resource that would have that resource that they need. So, for example, Cancer Support Community doesn't have food delivery, but we frequently refer to Food and Friends to connect people. And I would, fill out that application. Of course, with the patient or caregiver's consent and with their assistance, and complete that application for them, submit it to Food and Friends, and get them connected to that. So, if it's not something that we have, my role and my job is definitely to find out what is available in the community and connect them. So I hope that helps answer your question.
Yeah, that does. Thank you so much, Rachel. And we'll have more time for additional questions at the end of all the presentations. With that being said, I'm excited to introduce our next presenters, my former colleagues from Medstar Washington Cancer Institute, Ms. Carrie Miller, who is the Senior Clinical Social Work Coordinator, and Ms. Sarah Richmond, who is a Clinical Social Work Coordinator. So, Carrie, I think you should be able to share your screen.
Okay, thank
yeah,
you.
You're welcome.
Whoops. What happened? Here we go. Seba, it's saying, let's see, one participant can share at a time.
Okay, did you stop? You stopped sharing, right?
I did, I think.
Yeah. Okay, try again, Carrie.
Okay. Oh, here we go. Okay, I got it. Let me see. All right. Okay. Can everybody see the slides up there?
Yep.
Okay. So patient support services at Medstar Washington Hospital Center, as Seba briefly said, I'm the Senior Clinical Social Work Coordinator, and my coworker Sarah is on as well, and she is one of the clinical social work coordinators. There are 3 social workers here in our department. So we'll just briefly talk about the services that we offer here in PSS and at the Cancer Institute. And I'm going to let Sarah start off. So briefly, I'll just say, in addition to social work, we do have an oncology dietitian. Her name is Leah Hidalgo. We have a patient financial coordinator / navigator. Her name is Kalisha Johnson. And during the school year, we do host interns, MSW interns as well. And we also recently just brought on a patient navigator who serves kind of like multiple functions. She helps with transportation related things and some other things. So with that, I'll let Sarah jump in to give you some information about what social work does, what we do here. Mm-hmm.
So hi, everybody. Seba, thank you so much for inviting us to participate in this, and it's good to see you again. So just as sort of like a caveat to our services are exclusive to Washington Cancer Institute patients. So this is not a community-wide service. But as Carrie was saying, we have 3 social workers here. And we tend to divide our work by cancer type. So we have 1 social worker for breast cancer, 1 social worker for like hematological, GI, and some other types. And then the 3rd social worker is for head and neck, lung, GYN, and some hematological. So as you can see here on the slides, we do distress screenings. We offer limited individual therapy if, our caseloads can allow for it, which can look like, emotional support, CBT, sleep disorders, eating disorders, things like that. We do a lot of case management. So, connecting people with community resources, like Rachel was mentioning, food and friends, home health aides, pretty much anything that's out in the community. We have a lot of educational materials in our department here. So we often give those to patients, and sometimes we'll attend like their medical appointments with them to help make sure that their questions are addressed. Now, Carrie will get into this a little bit more later, but we recently started a program where we give gift cards to patients if they're financially eligible. So we'll help out with like groceries, medical equipment, anything that can be considered like a household need. So clothing, cleaning supplies, they can use it for all of that. And we also let them use it for like emotional needs. So like if they needed to buy like a meditation CD or something like that, we would help with that too. And we do offer some rental payments. So we would do just 1 month's worth. Or if they're moving, we would help with the first month's rent and security deposit, as long as it doesn't go over our limit. Let me see, I just want to make sure. Oh, we also help if patients don't have cell phones, we will help them to buy those, especially with like head and neck patients. We'll help them purchase electronics so that they can communicate by email or some other way. Transportation is a big one. We help apply for Metro Access, MTM, things like that. We'll also, if they have Metro Access, we'll help to pay for that, for them to come to their appointments. And again, I think Carrie will get more into this a little bit later, but we recently started a breast cancer support group with the Smith Center. So that I think is twice a month. And it's also, so we host 2 groups at the same time. So one is breast cancer, one is for caregivers. And that's been going really well. And I think we are in the process of starting some more groups, which is the meaning-centered psychotherapy and the fear of recurrence.
Sarah, just to let everyone know too, those groups are community-wide. So they're offered through the Smith Center, but the patient or caregiver does not have to be a patient here at Hospital Center.
Neither does the patient really, because it's Smith Center hosts it. So it's not exclusive to Medstar Washington Hospital Center, even though we sponsor it.
Yeah.
And again, Carrie will get more into our grants, but we do have 5 different grants that we use to be able to offer this assistance. Carrie, you want to go to the next slide? Oh, Carrie, you're on mute.
Sorry, Sarah. Yeah, so this is the one slide that I have. The next slide just has our contact info. Okay. So I kind of just put everything onto one slide so we can just kind of go off of this. I didn't want to have too many slides.
Okay. And I think, so just to kind of go back over the financial assistance that we offer, like I said, it can cover like groceries, gift cards, things like that, but it can also cover nutritional supplements, like the Ensure or Boost, because those can be really expensive. It can be like $60 for one case. So what we'll do in that aspect is we will also refer to our nutritionist, Leah, to make sure that the patient, kind of is eligible for that aspect. And then once she says what, product to order for them, we'll do that. Did I leave anything out, Carrie?
No, Sarah, I think you covered a good chunk. I was going to mention as well that we do also have a medical legal partnership program, which has been really helpful for our patients. So we have a group of lawyers. There's 3 of them, right, Sarah?
So now there's 2.
Okay.
But they have been extremely helpful. So we would refer them for cases like if a patient needed to apply for disability or if their disability was denied, they would help them to appeal that. They have also they started an initiative to do advanced directives for as many patients as possible. And all their referrals are kind of funneled through the social workers. So if a nurse or doctor flags a patient for a legal need, they then refer them to us, and then we refer to the attorneys, just not to overwhelm them. And they also do monthly, I forget exactly what it's called, but it's like, it's a monthly virtual cafes where they do advanced planning in like a big group setting. So they can kind of educate patients on advanced care planning, but also, help patients more efficiently that way. But they also help with like landlord or housing needs. And, if there's any question of the patient's cognitive ability, they can kind of consult on that too. They're just a really good overall resource for us to have.
Yeah. So I'll talk a little bit more just about some of the, as far as financial help that Sarah had mentioned, and she already covered like a lot of the different things that we can help with. We also, I don't know, Sarah, I didn't hear you mention, we can also help with like over-the-counter or not over-the-counter, durable medical equipment. So if somebody needs like a shower chair or, rollator, what have you, and they have a co-payment on that, we can help with that also. We also oftentimes are the ones to fill out those requests on behalf of the patient, kind of do the work of getting the signatures needed and getting all the documentation together. And then also medication co-payments. So I just wanted to throw those in there as well. And so Sarah mentioned that we offer gift cards to eligible patients. So the program that we use is a really great one. I'll just put it out there for the rest of you if it ever is something that might be helpful within your organizations. So we use, it used to be called Shop with Script, it's now called Raise Right. So this organization is intended for nonprofit programs, and you can use this website to buy gift cards. There's thousands of different vendors that they have available, and you actually get them at a discount. Like I can purchase about $1,000 worth of visas for about $980 instead of paying the full amount. So it's a really good resource for nonprofits if that's something that within your organizations you all do, is like help people with things like that, giving gift cards or what have you. So we offer giant cards to eligible patients, Safeway, like CVS or Walgreens for any over-the-counter needs that they might have. For example, some patients getting radiation need like Aquaphor or certain things that the doctor suggests to them, which is a little pricey. So we are able to help them to make sure they can purchase those things by giving them a gift card. We do like gas cards as well, and Walmart cards for any like household needs, groceries, like if they need a winter coat or a pair of shoes or something, then we'll offer that to the patients. And just to give you an idea, we use a tracking system to track all of the assistance we provide. It's called RedCap, and within 1 year, we provided about 300 over 300 gift cards. It was about 350 actually, and we did about 900 transactions between gift cards and like helping, like Sarah said, with rent or utilities. So, you know, it's a big help for our patients and something that's needed desperately, as Saba said, especially over the past couple of years with COVID and, you know, more recently with folks kind of being hit by like evictions and things, now that those are, you know, everything's kind of lifted. So we try to do our best to help people to offset some of their costs. As Sarah did mention, it is restricted, those grant funds, to our patients, but it is something that we offer that is very beneficial for our patients. So that's all we had. I don't know if anybody has questions or anything to clarify. We're happy to answer.
Sorry, Carrie. I just wanted to mention that we do have a system. So our patients need to be financially eligible. So in order to do that, they have to be, their income has to be less than like 400% of the federal poverty guidelines. And that's based on their household income. So unfortunately, we just can't offer this to all patients. They have to be screened first.
Majority of our patients do meet the requirement though.
Thank you so much, Sarah and Carrie. I'm so really impressed by the growth of patient support services since I left. It sounds like you guys have really increased the resources that you provide to patients in terms of just, you know, counseling support and financial support too. So this is just wonderful. I do have a couple of questions before we get to our next presentation. You already kind of spoke to like the financial qualifications in terms of the poverty line. Are there any residency restrictions to, you know, I know that comes up a lot, and particularly with this peer group, because our navigators at the clinic, they provide services to a wide range of different, you know, types of patients that may have different residency status. And so are there any residency restrictions on any of the financial programs that you offer?
No, as long as they are coming to Hospital Center, to the Cancer Institute for their care, it doesn't, you know, there's no requirement, you know, and as long as they meet that financial requirement that Sarah mentioned. So that's not an issue at all.
Great.
And I did want to add on as well, sorry, Saba, I did forget, one other initiative we're working on is, well, we just got a contract partnership with BREM. I did notice Julia and Natalie are on, so it occurred to me to mention we recently were partnering with BREM to offer assistance for any folks maybe needing to come for screening, you know, mammogram or any type of screening, and maybe they don't have transportation. So we have partnered with BREM, and they will be able to get a lift. The potential patient would be able to get a lift ride here if they are unable to come based on a transportation need. So that's a great new resource we will add. And beyond that, one other thing we're working on is a contract with ThriveWorks to offer patients who are eligible and in need individual therapy services. And you know, again, all of us know this is highly needed and it's really difficult to come by lately these days for various reasons, but we're trying to get that contract so that, again, we can offer, it'll be limited sessions, you know, just to put that caveat out there, maybe 6 to 8 sessions, but more individualized therapy for our patients if they're eligible and, you know, coming to hospital center.
Okay, it looks like we have a couple more questions, so let's try to squeeze these in before our next presentation. Claudia, you have your hand raised. You can go ahead and ask your
Hello,
question.
thank you, and
Yeah.
good morning, everyone. Carrie, I have a question related to a cancer client who needs, for example, 30 days for radiation. The hospital provided transportation for clients who are receiving radiation daily, in daily basis?
Mm-hmm. Yeah, so as Sarah said, if the patient is coming here for radiation treatment, and if they're eligible for financial help, then we can cover the metro access costs. And we often do that. We have many patients, you know, who have to come for that 30, 35, 37 days. Yeah, and we will cover that for them.
Okay, thank you.
Sure.
And we have a second question in the chat box from Ina, who is our patient navigator at Community of Hope. So Ina, question is, do your navigators work closely with breast imaging? With breast imaging center at Washington Hospital Center in terms of scheduling patients for follow-up mammograms post-treatment? Or is this exclusively to cancer patients in treatment only?
So can I clarify? 'Cause I'm a little confused on the question.
Ina, do you want to?
Hi, yeah, good morning. This is Ina. Yeah, my question was like if your services of navigation are exclusively to the cancer patient that are going through treatment at that time, or anything happening like post-treatment, like scheduling follow-up with the surgeon or diagnostic mammograms post-treatment follow-up.
Yeah, our navigators, I mean, PSS in general and even outside of PSS, our nurse navigators and the other navigators, we work through the continuum of, you know, from diagnosis, you know, through active treatment into survivorship. We work through, you know, that whole continuum here in PSS and our navigators. So they do help with, you know, scheduling, any kind of follow-up. Yes.
Thank you. I just asked because, you know, we have couple patients that, you know, most of the time they finish the treatment and then they get lost. Like they forget like to go back for a follow-up 6 months with the breast surgeon or oncologist or to do their mammograms. So I was just curious if your department does navigate post-treatment patients. Thank you.
Sure.
Thank you so much, Carrie and Sarah. We have probably a couple more questions. I know you'll probably be very busy. If one or both of you could stick around for our roundtable just in case anyone has additional questions, that would be great. Thank you, Carrie. This is information that is really new to a lot of us, but this is amazing. I second Doug's comment in the chat box. It's amazing work. So now you can stop sharing your screen, Carrie, and we'll have we'll have Megan Polk with Sibley Memorial Hospital present. She is the manager of the NCR Center for Patient Services. Megan, let me know if you have any issues with sharing your screen.
Thanks, Seba. Hey guys, let me go ahead and share. And I'll be mindful of the time. I see we're at 10:20. Let's see. Okay, can you all see this PowerPoint here?
Yeah.
Okay.
Yeah.
Yes.
And Megan,
So-
I'm sorry, Megan, feel free to go over a little bit. I know
Okay.
we took up some of your time, so.
It's okay.
Yeah.
I just wanted to second everyone. Thanks, Carrie and Sarah, for sharing from Washington Hospital Center. I think you'll find a lot of our services are similar, just addressing a lot of the common issues that cancer patients will experience. But anyway, so I'm Megan Polk. I'm a social worker. I started at Sibley about 7 years ago as an oncology social worker, seeing patients on the outpatient side, and I now manage our department. And we're called the Center for Patient and Family Services. We're now the National Capital Region because we've linked up with our sister hospital, Suburban, to try to create one cancer center across all Hopkins campuses. So that's what that means. So you may see that more for Sibley and Suburban and Hopkins marketing materials. So just to give you sort of an overview, this is our department. So this is sort of tacks on a number of common issues that we tend to tackle. So we provide ongoing care coordination throughout the continuum from suspected cancer throughout survivorship after treatment and beyond. And I'll walk through sort of like what our department's made of, but no, generally it's social work, navigation, supportive programming, all of that's housed under our department. We're providing a lot of food assistance, especially after COVID. Transportation and housing are probably our two biggest barriers to care that we tend to address the most of. And I think you kind of see that across the board. And most of that obviously is a lot of radiation, and then also through the infusion center when patients are coming in through their chemo. But it really runs the gamut depending on what the patient's resources are. We help with insurance needs, accessing to making sure people have insurance and access to care generally. And I'll talk about our hospital financial assistance program. And then we also assist with any medication authorizations, those sorts of things, all sort of are help to navigate through our department. Medication management, our department houses the nurse navigators who do a lot of that education for our patients once they kind of start the treatment process, making sure they're always on the right page and they know what's going on, making sure all the appropriate appointments are scheduled, and obviously a lot of patient education, navigation. And then this sort of summarizes at the bottom, we're providing social work services and all of our support programming. Nutrition is also housed under our department. We have a dietitian on our team. Palliative care is also within the Center for Patient and Family Services. So we have an outpatient NP and an inpatient MD and NP as well. And then we're also providing distress screening. So this is kind of just like an overview, but we can get into the nitty gritty, I guess, more. So I did kind of jump right into our financial assistance resources because I know, Saba, that's what you kind of generally asked us to really focus on. So I want to make sure I get to those. So generally, just to kind of give you an overview, I know most of us should know that all hospitals have some form of financial assistance, but we navigate a lot of patients through this process. And so I just wanted to make sure that you all know what it is and what it covers. So Sibley Hospital provides financial assistance up to 100%. They do it based on 200% of the federal poverty level, and that's based on your income and household size. They have a sliding scale available, although we push to make sure all of our patients get 100% coverage if we can. It doesn't cover things like prescription and home care, so that's where our department kind of steps in to use a lot of our foundation funds. And then the application process is typically, if you hit our doorstep, we're going to help you navigate the application, getting on all of your supporting documentation, and then we're going to help to babysit it with the financial counselors through the hospital to make sure that you get approved, that there's no delay in care. We work really closely with administration, so if you have an application that's pending, but we know you're going to get approved based on eligibility, we're not going to see any delays in care, and we're going to push through and make sure all your treatments and your appointments take place on time. So just generally, I put this information down just so you're aware. I know it's kind of different at different hospitals. I realize I didn't put it here, but they do also have presumptive eligibility. So if you have a patient that is already receiving SNAP benefits, or if they have children that are on free lunch program, anything like that, they're automatically presumed to qualify for this assistance. And so it makes the process a little bit faster. So just generally putting that information there, I'm happy to share. I do have the application available that I can send. I pulled it up here. I'm happy to show you. See if I can do a new share. Oh, for some reason, I'm not seeing it. Okay, I can share that afterwards if anyone's interested. But generally, it kind of walks you through just the application process. So then the sort of bigger picture for what we're providing through Center for Patient and Family Services. So we essentially have a number of different foundation funds. Lucky for us, Sibley is centered in a very affluent area of DC, to be frank. And so we have a lot of grateful patients. And over the years, they've amounted a lot of resources for us to tap into, which is wonderful. It's how we've been able to grow such a large department and provide just so many resources in-house. So essentially the way this works, or how we've developed this, is our barriers to care for patients are determined by social work assessment. Our nurse navigators may also flag a number of issues, but generally you're going to have a social worker follow up to screen the patient and see if they qualify for our in-house assistance, or can we bridge them to another program? Do we need to do a combination? All of that's sort of developed during an interview or that social work psychosocial assessment with the patient. And then a plan is sort of developed with the patient as to, you know, okay, you've got 4 or 5 weeks of radiation, but then you're going to be followed up with infusion. So let's, you know, maybe based on your eligibility, you qualify for 3 weeks of assistance with us. But in that time, we're going to bridge you to Metro Access or whatever that next resource may be. And I'm using transportation as an example because it's a very common one that we help with. And so beyond that, we also help with housing. We have a proton center that was opened a couple years back here at Sibley. And so we have people coming from all over trying to have access to our proton therapy center. And so we work with area hotels and other programs, like we have pediatric patients that are coming here. So we work with Ronald McDonald House. But we also work with, we have a contract with like the Marriott for a discounted rate, either for the patient to pay or we cover the cost. We also work with the Embassy Suites here in DC, the same sort of arrangement. But that obviously we've seen a lot more of those. And thankfully we got a lot of donation dollars before that opened because we knew this was going to be a major ask. And we don't have any housing dedicated here like they do in Baltimore. They have like Hackham and Pat's. So that's a common one we help with. Prescription assistance, we work with our pharmacy out of Baltimore. It's the Weinberg Pharmacy through the Oncology Center. As long as we have orders in by, I think like 2:30 every day, we can do same day delivery for anything. And so the social workers manage all of that. Now, usually for that, again, all of this is really intended to be a longer term bridge because we don't want patients solely relying on us for everything. We want to make sure they have resources when they, you know, leave our program. But we can help. I mean, in a pinch, it really is a lifesaver for a lot of these patients. We assist with home care services. We tend to work primarily, I mean, because we're Hopkins, they have Hopkins Home Care Group. Potomac Home Support is also a Hopkins program. And then we have contracts with a couple other programs to make sure that patients get adequate home care for whatever they may need. And then we'll also, again, bridge to other programs as well. And then I listed childcare here. So we started working with care.com to create a contract to provide childcare for patients. And then, I mean, theoretically, you could extend it out for home care as well for adults, but it grew out of the need for childcare. So I actually, just for other sites that might be interested, I just met with their corporate liaison last week. So apparently this is not something they've done in the past, but since COVID, they've started to have other places reach out to see if they could set this up for us to cover for patients. And so they're basically developing some sort of process for us to be able to access it. But I think it's going to look very similar to resources they have for like employers to help with employees. So for example, Hopkins had a like their backup care program for employees. So they're going to try to create something similar for us to be able to offer it for patients. And it's severely discounted. It's like $2 to $8 an hour, or like $15 a day for childcare, which is pretty cool. So we can either cover it, or if the patient can afford it at that rate, then we can help them to access the discount. I put our eligibility criteria here. So we have a sliding scale. Ours is 300% of the federal poverty level to access our resources. You do have to be a patient at Sibley in order to access these. We don't have any limitations based on residency. You just have to be receiving care here. And again, everything's completed by the social work team, and I manage all of our foundation funds beyond that. So then I'll also give a quick overview of just our department. I'm going to just stop my share real quick just because I need to pull up. There we go. Okay. All right, can everyone see this too? Yeah, I'm going to assume yes. So I just used, this is our brochure. I just use this to kind of be able to quickly walk you through our department. So essentially, Center for Patient and Family Services covers a lot of different areas. So we have financial counseling, which has sort of evolved over the years. We used to have a financial navigator, and then Hopkins centralized financial counseling. So it really changed the title, but we're still having them perform the same duties. So essentially they're meeting with patients, they're screening all of our new patients for any access issues with regards to insurance. And then we do try to do early intervention before a patient arrives on our doorstep so that we can make sure they have a plan going forward so that we have no potential interruptions to care. Nurse navigation is a big pillar of our department. We have 7 navigators right now, and they cover a variety of different diagnoses. So we have one for brain and hematologic cancers. We have two breast cancer nurse navigators, one for head and neck and sarcoma cancers. We link those two together because it's the same provider. Gastrointestinal cancers, we have a nurse navigator for that. We have another nurse navigator that covers genitourinary and thoracic cancers. And we have another navigator for gynecologic cancers. I don't think it's its own. Yeah, okay, I'll just mention. We also have a program linked up with Unity Healthcare to provide cancer navigation services through anybody going through the Unity the Unity Healthcare program. And then we also work with anybody coming from Ward 7 and 8. So we have a dedicated non-clinical navigator and nurse navigator and a nurse practitioner located at the Parkside location. And so essentially we get referrals from the Unity providers for anybody with a confirmed or suspected cancer diagnosis, and we help them to get seen up here quickly for any diagnostic workups and then to be seen through our cancer clinic. And again, we work with the patient from that point into survivorship. Again, palliative care. Sue Ely actually just retired a couple of weeks ago, so they're backfilling her position now, but we do offer palliative care resources for our patients, inpatient and outpatient. Our social work team, we have 4 social workers. Stop me if I'm going too fast. I'm just trying to cover all of it. I didn't realize how long.
No, this is great information, Megan. Keep going.
All right, I'll keep going. Our social workers, so we have 4 right now, not including myself. So I'm no longer seeing patients clinically as an assigned diagnosis. So I sort of jump in where I'm needed when we get busy, which can happen. So we have our lead social worker works with all of our outpatient heme patients. And then she also acts as a liaison for any of our patients that get admitted. Basically, it helps so that nothing falls through the cracks once they're discharged and transferred back to outpatient care. We make sure all their appointments are scheduled, they have everything they need. And then she provides, counseling, adjustment to illness. She's present for goals of care conversations. It's really a nice, unique position. It's helped to catch a lot of patients that may have fallen through otherwise. We also have a GI, GU, and melanoma social worker that covers those diagnoses. One that covers all the breast and gynecologic cancers, and head, neck, and sarcoma. And then we also have one that covers all the brain, heme, and pediatric cancer diagnoses. So if you couldn't tell off the bat, we are in the market for new social work soon. I think we'll, because we have a just expanding diagnoses and a lot of new docs coming down. So we'll probably be growing that program sometime very soon. Our social workers also manage all of our support programs, or support groups, I should say. So you'll see our metastatic discussion group for patients with metastatic disease. And all of our support groups, I should say, are open to anybody in the community. So anybody can access these. And we're located on a lot of community groups or community websites to make sure we're directing people from all over for these. Our brain tumor support group also meets monthly. We have a breast cancer support group. We actually have 2 breast cancer support groups right now. One is a general breast cancer support group, and the other is for young adults under 50. I don't see that broken out here, but we do have those probably in the newer version of this. Our suburban counterparts also run a breast cancer talk and walk support group, which is a little more involved than just your traditional support group. Our gynecologic support group has been one of our longest running groups, and that one meets monthly as well. And I'm not seeing it on here, but we recently started back up our cancer caregiver support group. If anybody's ever tried to run a caregiver support group, it tends to ebb and flow, but we've had good buy-in, so we reopened that group. And at Suburban, they offer our prostate cancer support group as well, and also our pancreatic. I will also send you guys this information so you don't have to remember all of it, because we have quite a bit. Oh, and then we have a number of support programs. I have them listed here. We don't have to walk through all of them, but just know our programs, our survivorship programs manager, Pam Getz, is just a wealth of different resources for our patients to address integrative health needs. We still run our Look Good, Feel Better community seminars, and then our caregiver workshop is also really well attended. And then we more recently, our programs, I think, are the art therapy, the survivorship series, and the Reiki self-care practice, which the Reiki program we also offer to employees, which was really nice as well. I think that covers the bulk of most of our other programs. I'll stop here to see if there are any questions about like our financial assistance or any of our programs that we're offering.
Thank you, Megan. This is great, great work. I'm just really, really proud of Sibley. It's definitely come a long way with the resources that it offers to patients. And you touched a little bit on the transportation piece, and I know because Sibley is kind of, you know, tucked away in its own little section in DC. Sometimes that can be a deterrent for patients in terms of treatment. So can you speak a little bit more about the transportation options available to patients that may need like radiation treatment, you know, chemo, et cetera?
Thanks for reminding me. I made a note here so I didn't forget this. So our transportation program, we utilize a platform called Round Trip. If anybody, any of these is interested in it, we started using it at our Bayview campus. It's super, super easy. It's essentially like a third-party group that created a platform so you can easily book rides through Uber or Lyft, but then you can also book medical sedans, wheelchair transport, you can book stretcher transport, and they're all at discounted rates. So we started using them at the end of 2019, I think, like right before the pandemic. And it just made everything so much easier. Before that, we were using like cabs and third-party companies. So essentially, if you qualify for our assistance, that's what we use. The majority of our patients are ambulatory and don't need assistance, so we can use things like Lyft and Uber. Beyond that, we can assist, like I said, with medical sedans. We do help, if you qualify for our assistance, we'll help you through the entirety of your treatment. you know, especially for some of our patients that maybe there's a health literacy issue, or, you know, even if we could bridge you to like metro access for other things, and we can do that. If we feel like you're really going to get through your treatment best by having us assist with all of your rides, we're going to do it. So it's kind of like case by case. We also reserve the right to extend that, and you may see that at other cancer centers too. It's just sometimes that hard and fast, like 300% or 400% federal poverty, doesn't extend to everybody. So if I'm working with a brain tumor patient, and I know the majority of their funds are going to need to go to home care at some point down the road, even though right now they don't meet my criteria, I might say, like, why don't we cover your rides? Why don't we take care of that for you? Because medical sedans or wheelchair transport, depending on the needs of the patient, is going to bankrupt you out the gate. And I know you're going to need those funds later. So that's why a lot of this is held within our social work department, because we're looking at the whole patient. So hopefully that answers your question.
Yeah, that does. Thank you so much, Megan. That's really helpful to know that that's an option for patients. I had a second question about the home care piece, and that's something that as a social worker in the oncology setting, I find a lot of patients as they go through treatment, of course, they become deconditioned, and depending on if they have a loved one to assist or not, that can be, you know, a barrier for them. And so the home care piece, is that more so in terms of caregiving or physical therapy?
Well, the majority of our patients are going to have some sort of, I mean, if you're already receiving treatment with us, you're on some kind of insurance, or you're on financial assistance with the hospital. Thankfully, our home care group, we have negotiated with them to basically say, look, if somebody's getting hospital financial assistance, you should honor it with home care, because it's the same umbrella Hopkins group. So we're able to do that in a lot of cases if that's a barrier. And then, so essentially those patients for any sort of like skilled care, all of that should be covered under their insurance or financial assistance. Beyond that, anything that's like private hire, that's kind of where we would usually step in if we have to. And, you know, that's an expense, that's a big expense. So, you know, no, I'm not going to say that our department can afford 24-hour care every day for patients, but if I can help here and there with a nurse visit or some things to help bridge them, we use other community programs to help connect them for longer term. That's definitely one that is an issue. And I think even during the pandemic, a lot of our social workers are giving feedback. It's just harder to find even the skilled agent staff.
It is.
Nobody's immune to, you know, a lot of people resigning, and so that's something I'm sure we're all running up against.
Yeah. Thank you. That's good to know. Are there any other questions for Megan or for Sarah and Carrie at Medstar that maybe we didn't cover? Actually, I do have one question for all three of you. The support groups, are they virtual or in person?
Ours are virtual, Saba.
Okay.
Same here. All of our programs are still virtual.
Okay. Any other questions from audience? If not, I want to thank you so much, Megan, Sarah, and Carrie, for taking time out of your busy schedules. I know how it is on a day-to-day basis. So I know you're in high demand from physician, nurses, and patients. So I can't thank you enough for sharing this information. Please send me your slides. The brochure that you shared, Megan, would be great as well, so I can send it out to the group afterwards.
Saba, I can share our flyers for the groups through Smith Center too.
Oh, that would be great. Thank you so much, Carrie.
Sure.
Yeah, and
Thanks
hats off to you for the wonderful work that you do. I feel connected to both of your hospitals, having worked there. So thank you again. And thank you, Rachel, for sharing all the information about your organization. And please send me any brochures that you may have as well. So
thank you for having me too. It's great to be here.
Of course. So right now we'll just open it up to any announcements that participants may have. I know we haven't met for a couple of months, so feel free to share any updates that your organization may have or any upcoming events. So just want to open up the floor.
Sorry, Saba, I just wanted to shout out Rachel and just how awesome she is, because I've referred so many patients to her, and just recently one of my patients couldn't afford a prom dress for her daughter, so Rachel found a resource that I will try to use now, but the patient came to me like in tears. She was like, this means so much to me. So Rachel's awesome. So refer your patients to her.
Oh, thank you. Thank you
Thanks,
for
Sarah.
sharing that. Thank you, Rachel. That sounds quite challenging. So glad you were able to assist with that. I know we had one participant reach out to me to share about a research study that she's conducting.
Hi,
Yeah, Rebecca, if you want to go ahead and speak about that right
okay,
now.
awesome. Thank you so much. Like Saba said, my name is Rebecca Brown, and I am a student at Brigham Young University, and I'm here for the summer doing research about access to cancer care. So the question we're trying to answer is how cancer patients decide where to seek care. And we're currently recruiting participants. Eligibility requirements include being an adult, so over the age of 18, from a resident of Ward 7 or 8, and they have to have, this might change, but we're looking for people who have been diagnosed with cancer in the past 12 months. So they're on the participants part, they're just signing up for a one-time like 30-minute interview about their experience, and they'll receive a $50 Amazon gift card afterwards. So I have a flyer, and I can also put my email in the chat if y'all know of anybody, or if you have support groups or newsletters that you could pass the flyer on to. That would be really helpful. So thank you so much.
Yeah. Thank you, Rebecca. I'll make sure to send that information out to everyone as well. It sounds like an exciting study, and definitely would be interested in bringing you back to share your findings once you finish up your study. So thank you for sharing. And I hate to put Julia on the spot, but I know she always has great updates from BRIM. So Julia, is there any updates with BRIM Foundation you wanted to maybe share really quickly?
Hi everyone. Some really amazing resources that just got shared. It was very inspiring. The main one on the BRIM end, we're doing lots with our educational videos. But on the access side, we are really growing the Wheels for Women program, which for us, I'm hearing again and again, transportation is a challenge. We are focused on early detection. So our LIFT program is focused like up until diagnosis and not past, but I am hearing there are transportation programs sort of past the diagnosis point, but we are really growing, and we started the year with 10 partners around the DMV and Baltimore, and we now are just up to 15. So to the extent that you think it could be useful for your patients that are seeking diagnosis and screening, we are interested in expanding. So I'll stick my email in the chat.
Okay, thank you, Julia. I just wanted to bring up a topic for discussion to see if anyone has had a similar situation or can provide feedback. One of the navigators with Community of Hope, Ina, recently had a patient who is from Ina, what country was it? I believe it was someone,
Yeah,
a Ukrainian refugee.
Yeah,
So
it's a
yeah.
74 years old female. Came from Ukraine with a tourist visa to visit her daughter, but due to the war happening, she was not able to return to her country. So she was diagnosed with breast cancer 2019 in Ukraine, had her treatment there. She's in remission now, but she still needs like follow-up appointments to the specialist. As I mentioned before, when I was asking post-treatment cancer appointments. So her daughter, she's a DC resident, was looking for resources, how can have her mom enrolled into maybe DC Alliance if she qualifies, but however, being on tourist visa, I think she's not qualifying for that, but we were looking resources if there are any updates from DC Health specifically for Ukrainians because of the war and they're not able to return back. Yeah, so if you have heard anything about that will be very good information to know. She came to our clinic. She had her mammogram through our partnership at Washington Radiology Associates. Everything is fine. It's just she's still seeing oncologists and other specialists because of some side effects from the treatment. So she does not have insurance. So that's why we were looking for resources if she qualifies for any out there resources. So please share if you know anything that can help.
And were you able? I know DCDOH had reached out to you. Were through Project Wish? Have they been able to provide any resources?
No, I have not received any kind of resources if she could qualify for Alliance. But I was wondering if there are any resources that will help her to see other specialists, if not DC Alliance.
Yeah.
Have you reached out to the healthcare ombudsman in DC?
I'm sorry?
We use the healthcare ombudsman's office in DC a lot when we have these kind of unique cases and we kind of get stuck on what we can do. The healthcare ombudsman, Maud Holt, has always been really just a wealth of information and able to connect us with a lot of resources. It's just the DC healthcare ombudsman's office. I would recommend giving them a call to see if they can maybe put you in the right direction.
Sure, thank you.
Yeah. And another suggestion I just thought about, Ina, and I was hoping that Carrie or Sarah was still on, because in the past, when I worked at the Cancer Institute, we would connect patients to Catholic Charities, their primary care team. And then under their charity program, they would refer patients to specialists in the community, including oncologists. So I'm not sure if that program still exists, but that might be another option through Catholic Charities.
I was going to say the same thing, Catholic Charities or Unity Healthcare. They can come through the Unity Healthcare umbrella, get a referral from them to see specialists, and Catholic Charities, same thing.
Okay. Thank you, Ariel.
You're welcome.
Any additional announcements, thoughts? If not, we'll go ahead and close out the meeting. And again, thank you to our wonderful presenters. I did see some folks from GW on here earlier, so definitely, hopefully we can have them on at our next meeting for them to share some of their resources as well. Thank you all for attending. If you can please mark your calendars for our next meeting, which is scheduled for September the 27th. We'll go ahead and save the date, and I will be in touch with regarding the agenda for that meeting. But again, thank you for taking the time out of your busy schedules. Happy 4th of July. Take care, and I will be sending the recording as well as the meeting attachments to all the participants within the next couple of days. So take care, everybody. Have a great rest of the day.
Thank you.
Too.
Thank you, Saba.
You're welcome.